Welcome to the City of Austin Retiree Open Enrollment video. Open enrollment begins October 12th and ends November 15th, 2020. The 2021 benefits information can also be found online at austintexas.gov/retirees. This is your opportunity to make changes to your benefit elections. You can add or drop dependents, enroll in, or change your benefits. You may also cancel any of your benefits at this time. Changes made during open enrollment will become effective January 1st, 2021, and the first premiums are deducted from your January annuity check. Your individual retiree coverage information statement has been mailed to your address on file. If you haven't received yours, please contact the Employee Benefits Division at 512-974-3284. The coverage information statement shows your current 2020 benefits with the 2021 rates. It also includes the names of your dependents enrolled in benefits. If you find a mistake, such as an incorrect date of birth for a dependent, you can update the information through the open enrollment system or by calling the open enrollment phone number. If you want to make changes after reviewing your open enrollment materials, there are two ways to participate in open enrollment: online or by telephone. The online enrollment system begins October 12th and ends at midnight November 15th. You will need your retiree personal information number, which is located on your coverage information statement, and the first 5 numbers of your Social Security number to access the online enrollment system. The telephone enrollment phone number is available between 8 a.m. and 5 p.m. Monday through Friday from the beginning of open enrollment through November 6th. Call 512-493-1350. Operators are available in English and Spanish. When you complete the online or telephone process, you will receive a confirmation statement via email within 1 day or mailed to your home address within 2 business days. Carefully review your elections as well as your tobacco status. If you find a mistake in your confirmation statement, you must repeat the open enrollment process to make corrections. If you don't receive a confirmation statement, it is likely your changes were not accepted. Please access the online enrollment system or call 512-493-1350 to verify your changes or repeat the process. For 2021, the city continues to offer 3 medical plans. The first plan is the Consumer-Driven Health Plan with a Health Reimbursement Account, or CDHP with HRA. This is a high-deductible health plan with lower premiums than a traditional health plan. The PPO is a traditional health plan with copays, coinsurance, and deductibles. And the HMO is a traditional health plan that requires a primary care physician for services and referrals to be covered, and there is no out-of-network coverage except for emergencies. Each of these plans will be discussed in further detail. Let's start with the CDHP with HRA. This plan encourages wise choices in the use of healthcare services and has lower premiums than the HMO and PPO plans. With the CDHP with HRA, you have access to in-network and out-of-network services. You can choose any doctor, clinic, hospital, or healthcare facility, but you save money when you use in-network providers and facilities. The CDHP has a health reimbursement account as part of this plan. Funds draw from your HRA for eligible medical and prescription expenses. The city contributes money to your health reimbursement account on an annual basis. The city will contribute the funds as follows. For retirees with 20 or more years of service, $500 for retiree-only coverage and $1,000 for retiree independence coverage. For other service-level contributions, please review the contribution chart on this slide or in your retiree guide. Preventive care, such as routine physicals, well checkups, mammograms, and colonoscopies, are covered 100% in the network. The annual deductible for the CDHP for retiree-only coverage is $1,500, and for retiree independence, it is $3,000. After you reach the deductible, the plan pays 80% when a Tier 1 provider is utilized, or 70% with an in-network provider for eligible covered services and facilities. A Tier 1 provider is designated as providing higher quality of care and cost efficiency. To find a Tier 1 provider, visit bcbstx.com/COA, then utilize the Find a Doctor tool. The annual out-of-pocket maximum is $5,000 for retiree-only coverage and $6,850 for retiree and dependents. When you visit the doctor, your HRA pays first. The entire cost of the visit will apply to your deductible. The HRA will pay for all of your eligible expenses first, up to the amount contributed by the city. This means you won't have to pay anything until the money in your HRA is exhausted. If you spend all of your HRA money, you will need to pay out of pocket. You will need to pay the full cost of your healthcare expenses until the deductible is met. When you reach the out-of-pocket limit, which includes the deductible and coinsurance, the plan pays 100% of covered services for the remainder of the calendar year. Now let's talk about the PPO plan. With the PPO plan, you have access to in-network and out-of-network services. You can use any doctor, clinic, hospital, or healthcare facility, but you save money when you use Tier 1 or in-network providers and facilities. You have some coverage if you need to go out-of-network. Choose what's best for you. Just remember that out-of-network providers will likely charge you more. Out-of-network providers can even bill you for the amounts over what your plan will cover. When it comes to paying for services, here are some basic costs. Preventive care, such as routine physicals, well checkups, mammograms, and colonoscopies, are covered 100% in-network. Office visits to your primary care physician will be $10 if a Tier 1 provider is utilized, or $25 for a network provider. Office visits to a specialist will be $25 if a Tier 1 provider is utilized, or $45 for a network provider. Emergency room services are covered at a $200 copay. For major diagnostic services, including MRI, CT, and PET scans, there is a $100 copay. Minor lab, X-ray, and preventive services are covered at 100% with no copay. The annual deductible for the PPO plan will be $500 for individuals. The deductible for this plan only applies to outpatient surgery, hospital admission, ambulance services, or durable medical equipment. After you reach the deductible, for eligible covered services and facilities, the plan pays 80% when a Tier 1 provider is utilized, or 70% with an in-network provider. For hospital admission, if you use an in-network provider instead of a Tier 1 provider, a $250 copay will apply in addition to the deductible and coinsurance. The individual annual out-of-pocket maximum is $4,000. The out-of-pocket maximum includes deductible, coinsurance, and copays. The family out-of-pocket maximum is $12,700. Now let's discuss the HMO plan. The HMO plan will require you to select a primary care physician for yourself and each of your covered dependents. You will need a referral from your selected primary care physician to access other services, such as specialists, except for urgent or emergency care. If you have not selected a PCP, one will be designated for you after 30 days. To change your PCP throughout the year, call the number on the back of your medical card. The change will go into effect the first day of the following month. The HMO plan has a service area requirement. You must receive services in the following counties: Bastrop, Blanco, Burnett, Caldwell, Hayes, Travis, and Williamson. When it comes to paying for services, here are some of the basic costs. Preventive care, such as routine physicals, well checkups, mammograms, and colonoscopies, are covered 100% in-network. Office visits to your primary care physician will be $10 if a Tier 1 provider is utilized, or $25 for a network provider. Office visits to a specialist will be $35 if a Tier 1 provider is utilized, or $55 for a network provider. For emergency room services, there is a $250 copay. For major diagnostic services, including MRI, CT, and PET scans, there is a $150 copay. Minor lab, X-ray, and preventive services are covered at 100% with no copay. Outpatient surgery will be $750 if a Tier 1 provider is utilized, or $1,000 for a network provider. Inpatient hospitalization will be $1,500 if a Tier 1 provider is utilized, or $2,500 for a network provider. Services are available at in-network providers only, except for emergency situations. There is no deductible for individuals or families on this plan. For retiree-only coverage, the out-of-pocket maximum is $4,500. For retiree independent coverage, the maximum is $8,000. The out-of-pocket maximum includes copays and coinsurance. Each of the medical plans offered includes prescription drug coverage. The prescription drug list is the list of prescriptions that are covered by the plan and organized by cost tiers. To know if a prescription is covered, you can check the prescription drug list. You can find these lists at austintexas.gov/benefits. Choosing medications in the lower tiers may save you money. Tier 1 medications typically include generic drugs. Tier 2 medications are preferred brand name drugs, and Tier 3 medications are non-preferred brand name drugs. Affordable Care Act mandated prescriptions for preventive medications are covered at 100% under all medical plans. For the CDHP with HRA, there is also a preventive drug list. There is no deductible and the plan pays 80%. There is also a basic drug list. The plan pays 80% after the deductible is met. For the PPO, there is a $10 copay for Tier 1 medications. Tier 2 medications will have a $30 copay, or 20% of the cost, with a $60 maximum. Tier 3 medications will have a $50 copay, or 20% of the cost, with a $100 maximum. A $50 deductible applies to Tier 2 and Tier 3 prescription drugs per covered person per year. You can continue to get a 90-day supply through mail order for only 2 copays. For the HMO, there is a $10 copay for Tier 1 medications. Tier 2 medications will have a $35 copay, or 20% of the cost, with a $70 maximum. Tier 3 medications will have a $55 copay, or 20% of the cost, with a $110 maximum. A $50 deductible applies to Tier 2 and Tier 3 prescription drugs per covered person per year. You can continue to get a 90-day supply through mail order. However, 3 copays still apply. If you or your spouse or domestic partner are enrolled in a city-sponsored medical plan and use tobacco products, a $25 premium will be charged per person per month. Let's talk about how you can avoid paying the tobacco premium. If you completed the Tobacco Cessation 101 class between January 1st, 2020 and September 30th, 2020 and no longer use tobacco products, you must participate in open enrollment and select the non-tobacco status option to avoid paying the tobacco premium beginning January 2021. Attending the 2-part Tobacco Cessation 101 class from January 1st, 2020 through September 30th, 2020 only waives the premium for 2020. Attending the classes scheduled October 1st through December 23rd, 2020 will waive the premium for 2020 and for 2021. The Tobacco Cessation class schedule is available at austintexas.gov/benefits. The city offers retirees the option of selecting from 2 dental plans. New for 2021, we are offering the Blue Care Dental PPO. Those currently enrolled in the Cigna plan will be automatically transitioned to this plan if no action is taken during open enrollment. This plan offers you the choice to seek services from in-network or out-of-network dentists. Selecting a dentist from the Blue Care Dental PPO network will offer you the greatest savings. When contacting a dentist, ask whether the dentist participates in Blue Care Dental PPO network. To find a dentist, view claims activity, or for more information, call Blue Care Dental at 888-907-7880 or visit bcbstx.com/COA. Plan features include the freedom to choose the dentist of your choice, coverage for in- and out-of-network dentists, preventive care with no deductibles, basic, major, and orthodontia care for a $50 annual deductible per covered person. The calendar year maximum is $1,000 per covered person, including orthodontia treatment, and the orthodontia lifetime maximum is $1,000 per covered person. If you seek services from an in-network dentist, your claim will be paid in full and you will not be balance billed. Your coverage will be based on reduced contract rates, and it will take you longer to reach your calendar year maximum of $1,000. If you seek services from an out-of-network dentist, your claim will be paid based on the city's table of allowance. The fixed fee schedule indicates the maximum allowable amount that will be paid per code. Orthodontia services are covered at 50% of the maximum allowable amount. The Sun Life Financial DHMO plan is a prepaid dental plan that offers benefits through a network of plan dentists. Members must select a network general dentist if enrolled in this plan, and you are responsible for specific copay amounts when services are provided by a network dentist. Members can use the specialty plan to obtain services from a network or non-network specialist for specific services listed in the member plan documents. Plan limitations and exclusions apply. If you move out of the service coverage area, you have the option to drop or change coverage. See the plan documents for details. Plan features include no deductible and no waiting periods, coverage for pre-existing conditions, no claim forms to file for plan dentist and plan specialty dentist services, no referrals are required for specialty dentist services, and there is no annual maximum for plan dentist and plan specialty dentist services. Plan specialty benefits have a copay schedule. Refer to your plan document for copays. To find a dentist or for more information, call 1-800-443-2995 or click the Find a Dentist tool in the Tools section of the Sun Life website. Davis Vision is the City of Austin's vision provider, offering you and your dependents coverage for annual exams, glasses, or contacts. Routine eye exams can ensure that you have clear vision and can detect a variety of medical conditions such as diabetes and glaucoma. Davis Vision offers a comprehensive dilated eye examination each calendar year for a $10 copay. They have a large network of providers as well as retail optical chain stores such as VisionWorks, TSO, Walmart's, and Sam's Club. The plan covers costs for either a pair of eyeglasses or contact lenses once per calendar year. A $1,000 life insurance is provided at no cost to all retirees, and you are automatically enrolled. You can update your beneficiaries at any time during the year. To update your beneficiaries, call us at 512-974-3284 to request a beneficiary designation form. All city retirees can receive free assistance researching and locating potential child care providers by visiting dfps.state.tx.us/childcare. Don't forget about the retiree discount page Perks Connect, which offers retirees and their dependents discounts on a variety of products and services. The city's wellness program, Healthy Connections, provides resources and incentives to help you meet your health and wellness goals. Retirees engaged in wellness activities have lower healthcare claims costs, fewer ER visits, and higher rates of preventive screenings. The wellness program can also save you and the city money by lowering overall medical claims, which means lower monthly premiums for you and the city. Becoming healthier is a lifestyle change and takes time, planning, and support. Our programs are designed to help. Healthy Connections encourages you to take the following actions for optimal health. Eat 5 servings of fruit and vegetables a day. Exercise at least 150 minutes a week. Learn stress management techniques. Use your self-care resources available through Blue Cross Blue Shield and maintain a healthy weight. Benefits of good health include feeling better, living longer, and being sick less often. Healthy Connections offers a variety of programs including group fitness classes, tobacco cessation classes, a diabetes program, and flu shots. You can call 512-974-3284 and ask to speak with a wellness consultant for information about any of our programs. We hope to see you at our next Healthy Connections event. Thank you for taking the time to review this year's open enrollment video. We hope you have enjoyed it and that the information has been helpful to you. Remember that telephone enrollment ends November 6th and online open enrollment ends November 15th. If you have any questions on any of the benefits that were discussed, please contact the Employee Benefits Division at 512-974-3284. We are available to assist you Monday through Friday from 7:30 a.m. to 5 p.m.